Hi everyone, sorry about the delay in coming live. We had some technical issues, but thankfully we're live now. So this is a video about low vitamin B12. We scheduled this video as we've been having a lot of requests here at the Brooke Surgery about low vitamin B12 and what people can do to try and first of all find out if they have low vitamin B12, and secondly what the symptoms are to identify that. So just to introduce myself, my name is Dr. Arshad. I'm one of the GPs here at the Brooke Surgery. And this is one of our videos in our live series. So far we've covered hay fever, our appointment system, and cervical screening, and today's on low vitamin B12, and if this could be the reason why you're tired all the time. So what is vitamin B12? And why do we need it? So vitamin B12 is a vitamin that's important for the nervous system in your body, and it can help with how your blood cells are made, particularly your red blood cells. To talk about vitamin B12 and why it's important, I do need to talk about the red blood cells to make sense of all of this. So, as you may know, the red blood cells help carry the oxygen in your blood, and they use something called hemoglobin to do this. And some of you may have heard the term of anemia before. Anemia is a term when we find out that you're having fewer red blood cells than normal, and because of that you're having low hemoglobin and therefore low oxygen. And there's different types of anemia, and each one has a different cause. So for instance, an iron deficiency anemia is when you have a lack of iron. So today we're going to talk about vitamin B12 deficiency anemia and the kind of signs and symptoms that can cause. So having a low vitamin B12 can cause your blood cells to be larger than they should be, and therefore they don't function as well as they should do. And that can lead to a number of symptoms which we're going to cover shortly. So what are the causes of low vitamin B12? There are generally four main causes of low vitamin B12, which is quite useful to be aware of. So some medical conditions or even surgery that affects your stomach or the upper part of your intestines can cause you to have an issue of absorbing vitamin B12, which can cause a deficiency. Similarly, any condition that affects your intestines, such as some things like celiac disease, and there's a number of other conditions as well, they can also affect your body's ability to absorb vitamin B12 too. Another thing that can affect your ability to absorb B12 is if you don't actually get enough in your diet, and therefore you're not getting the chance to absorb enough. And typically this can affect vegans, and I will talk about what kind of food products that you do need to consume so that you can get a healthy amount of vitamin B12 in your actual your system. And lastly, the thing that can affect your ability to get the right level of B12 is some medications, and it's worthwhile consulting us if you're unsure what medications can do that. So people can get low vitamin B12 as a result of not getting enough in their diet. So what kind of things has vitamin B12 in? So a diet that contains meat, fish, dairy products, that usually produces enough B12 for someone to get the right level. People who do not regularly eat these three things, meat, fish and dairy products, can often have a deficiency. So as I mentioned, vegans can have a deficiency. And also people who generally have a poor diet, living off things like takeaways or microwave foods, can sometimes find themselves having a deficiency too. One of the most common reasons to get a low vitamin B12 is a condition which is worth mentioning. It's called pernicious anemia. This is a condition that can affect your stomach. And the way pernicious anemia works is that your body's own immune system kind of attacks itself, and for that reason within your stomach it's unable to absorb the vitamin B12 that you get from your diet. So if you have this condition and you have a lot of vitamin B12 in your diet or even tablets, you might not actually get the right level absorbed because your stomach's unable to do so. This is important later because when we talk about how you treat vitamin B12, these particular patients will need a different strategy as opposed to just tablets. So what are the symptoms of vitamin B12? So as you notice, we talk about the title, is vitamin B12 the reason why you are tired all the time? So let's go through them. So if you do have symptoms of vitamin B12, you might find the following things might apply to you. And you might not have all of these. You might just have some of these symptoms. So let's talk them through. So first of all, extreme tiredness. You find yourself having a lack of energy throughout the day, sleeping more often, unable to complete the tasks that you're usually doing. You can feel faint with this as well, can get headaches. Sometimes you can get an element of breathlessness, and the reason you can get breathless is if you remember what I said earlier about your blood count. If your blood cells are too big and they're not functioning properly, they're not carrying as much oxygen, and therefore you can get breathless with it as well. Sometimes one of the symptoms can be paler skin or having a noticeable heartbeat. Linked with that, you can get things like weight loss or a loss of appetite. Some of the things that can be quite apparent in the mouth is that you can get mouth ulcers if you have a lack of B12. And also your tongue can be quite red and quite sore, and sometimes a bit more bigger than you usually expect it to be. So if you notice those things, sometimes they can be clues. Earlier I mentioned that vitamin B12 can also affect your nerves, so your nervous system. So some of the symptoms that people can start off with if they have a particularly low vitamin B12 is pins and needles in your hands and your feet. And along with the nerves which affect your hands and your feet, your eyes can be affected, so it can have problems with your vision if you have a lack of B12 as well. So along with this, the tiredness and the general aches you can get, the pins and needles, and vision, you can also get symptoms such as feeling anxious or more likely depressed. So this can be an organic thing which is not actually due to any other cause, it's actually due to a low vitamin B12, and not being able to focus or concentrate. Patients who do have low vitamin B12 have had it treated. Often they report some of these symptoms start creeping back in when the levels start dropping low, and they often find that they have an idea when the levels are dropping low. So if you feel like you've had some of these symptoms, there is a chance that you could have a low vitamin B12. Sometimes there are other causes as well. A number of other conditions can cause some of these symptoms, but if you've not had that diagnosed, it's worth considering vitamin B12 and seeing if those levels need to be looked at via a blood test. And also it's important for us to identify if you have low vitamin B12 and kind of treat this as soon as possible so that you don't get any of the other symptoms that I've mentioned before. And the way you can do that is by arranging a blood test with your doctors. Now, because of COVID, I know a lot of practices have had to postpone their blood tests. We have had to do that before, but we are doing our blood test now at the Brooke Surgery, and we're booking patients in. So for our patients watching, if you feel like there's a problem, these symptoms, simply send us a message via our green button on our website, and we'll get back to you the same day and get you booked in so that we can check these levels, okay? If you're not currently a member of the Brooke Surgery, but you would like to be, I'm pleased to let you know that we are accepting new patients. Check out our website or Facebook page for any further information, and you can sign up via our website. It's a simple form, you just fill it in, and once that process is complete, it takes about 24 hours. You can use our online service and we can get back to you the same day. And the good thing about our service is that you don't have to call, you can text anytime, and you don't need to book in advance. So let's go on to how we treat vitamin B12. So most low vitamin B12 can be treated with either tablets or injections depending on what's caused the problem. So we generally go for tablets to start with if the levels aren't too low. If the levels are particularly low, then injections are recommended to start off the treatment and then for you to continue on tablets thereon afterwards. So it all depends on the severity of your vitamin B12 deficiency and also some of the symptoms that you're having with it. Okay, so during COVID-19 we haven't been offering as many injections initially because of the reasons of lack of, so if you reduce the exposure to people, you're less likely to get COVID. So we have switched some patients onto a higher dose of the tablet, which is fine so long as you don't have any of those conditions mentioned before, such as those that affect your stomach. And we can monitor this until things are safer and we can give you the injections. In some cases, it's worthwhile trying to improve your diet. So if you find that your diet doesn't contain things like meat or dairy, eggs, fish, it might be worthwhile to try and kind of include that in your diet. And you'll even find that some foods are fortified with B12, such as like cereals often have that fortified. So you can use that as a source of vitamin B12. Again, depending on how severe your B12 deficiency is, it might be appropriate that you get in touch with us and discuss that a bit further. So, as mentioned, if our patients who are watching, if you have a deficiency in B12, refer to some of those symptoms I mentioned before. So some of the symptoms are tiredness, lack of concentration, feeling low, unable to concentrate, pins and needles in your hand, mouth symptoms, ulcers, a big red tongue. Those kind of symptoms can give us clues. If you think that applies to you, please send us a request via our online system, the green button on our website, www.brookesurgery.co.uk. And for those who are not our patients, we are taking patients here at the Brooke Surgery, so you can look at our Facebook page and sign up on our website. So that concludes our talk today. I will go through some questions that we're having, so I can see some have come through, and thank you for engaging with us. So let's go through some of the questions here. So it says here, one question here is, I've never had my B12 level checked before, but I feel okay at the moment. Should I get it checked? Good question. So, you know, if you go through this video and those symptoms don't really apply for you, you might find that it's not necessary for you to have this blood test. If you're having annual health checks, then it might be useful to get your B12 checked at that point. But if you're unsure, just have a chat with your GP beforehand. So at the Brooke Surgery, you can just send us a message and we'll get back to you. So it's also important to know that B12 is actually stored by your liver. So even if you have a mild deficiency, your body can have a level of storage that can supply you for a while, so that it gives you an idea. Another question we have had here is, when will the surgery start offering B12 injections again? So we are currently booking B12s in for B12 injections in particularly those at the high risk group, so the levels that are particularly low, those that have stomach problems that don't allow them to absorb B12. For everyone else, they are on a tablet at the moment, but as time goes on, we are booking more and more B12 injections in. So just simply get in touch with us and we can give you a clear answer about when and how we can book you in for that, okay? So thank you everyone for engaging with us today. If there are any questions after this live video is finished, feel free to actually post it on here and we'll do our best to get back to you within 24 hours. And yeah, thank you for tuning in. If you like this video, please like and share it for the benefit of your friends. And we will be holding a live video next week. We've been trying to do that every week. So please tune in and thank you for joining us today.